Welcome to your online training module, Introduction to Medical Entomology. In this unit, we will explore the guiding principles that assist vector control and surveillance programs within the region, highlighting the various organizations that provide international public health policies for vector-borne disease control. Key guidance in vector surveillance and control encompasses several critical areas that support effective public health practice. These include standardized protocols for the surveillance and reporting of vectors and pathogens, as well as the principles of integrated vector management that promote coordinated, evidence-based interventions. Guidance also covers outbreak detection, alert, and response mechanisms to ensure timely action during emerging threats. In addition, established recommendations address vector control strategies such as environmental management, chemical control, and biological interventions, along with best practices for the stockpiling and safe use of insecticides, including resistance management. Community engagement and risk communication are emphasized to promote public participation and trust, while One Health approaches integrate human, animal, and environmental health considerations to provide a comprehensive framework for preventing and controlling vector-borne diseases. Several international and global organizations play a key role in the development and dissemination of policies, guidelines, and best practices for the prevention and control of vector-borne diseases. The World Health Organization provides global leadership and evidence-based guidance for vector surveillance, control, and public health response. The Pan American Health Organization supports countries in the Americas by strengthening regional capacity for disease prevention and control. The World Organization for Animal Health contributes to managing vector-borne diseases at the human-animal interface, particularly within a One Health framework. Additionally, the Centers for Disease Control and Prevention of the United States offers technical expertise, surveillance guidance, and research support that inform national and international vector control efforts. The World Health Organization provides global and regional leadership in the prevention and control of vector-borne diseases, including malaria, dengue, Zika, chikungunya, yellow fever, and other vector-borne diseases. Its guidance encompasses international health regulations, integrated vector management frameworks, and standardized surveillance manuals that support consistent and effective vector control practices worldwide. In addition, WHO develops comprehensive strategic documents to guide long-term vector control efforts. A key example is the WHO Global Vector Control Response 2017 to 2030, which outlines evidence-based strategies and priority actions for strengthening vector control capacity, improving surveillance, and promoting sustainable interventions. This framework has been widely adapted by countries to support national and regional vector control programs tailored to local contexts. The Pan American Health Organization, a regional office of the World Health Organization, focuses specifically on public health issues within the Americas. They provide region-specific guidance on the prevention and control of vector-borne diseases such as dengue, malaria, Zika, chikungunya, leishmaniasis, and Chagas disease. Many countries in the region adopt the Pan American Health Organization strategies to guide vector surveillance and control programs. These approaches emphasize integrated vector management, promoting coordinated, evidence-based interventions that are adapted to the ecological, social, and epidemiological context of the Americas. The U.S. Centers for Disease Control and Prevention provides both national and international guidance and resources for the prevention and control of vector-borne diseases, including malaria, dengue, West Nile virus, Zika, chikungunya, Lyme disease, and other tick and mosquito-borne infections. In addition to technical guidance, the CDC develops resources on vector-borne disease policy, surveillance methodologies, and risk assessment, as well as travel advisories for individuals visiting specific countries or regions. Many countries adapt CDC guidelines and tools to strengthen their own vector surveillance systems and disease prevention and control programs. The World Organization for Animal Health, formerly known as the OIE, provides international guidance on the monitoring, surveillance, and reporting of vector-borne diseases with a primary focus on animal populations. Its guidelines emphasize the detection, reporting, and control of animal reservoirs and vectors associated with zoonotic vector-borne diseases. Countries adopt their reporting standards and control guidelines to support regional and international harmonization of disease surveillance and information sharing. These standardized reporting mechanisms facilitate coordinated responses, strengthen early detection of emerging threats, and support a One Health approach to managing vector-borne diseases across animal, human, and environmental health sectors. In practice, international and regional guidelines should be used strategically and adapted to local contexts. Global recommendations from the World Health Organization provide a foundation for vector control policies and country-level adaptations. When applicable, guidance from the Centers for Disease Control and Prevention can be consulted for surveillance case definitions and travel-related risk assessments. In the Americas, the Pan American Health Organization offers region-specific guidance for diseases such as dengue, Zika, and malaria. National health agencies should be referenced to ensure compliance with local regulations and alignment with existing vector control programs, while professional infectious disease and tropical medicine societies can provide clinical management recommendations. Although numerous organizations contribute to vector management, not all guidelines are directly applicable to every region. Therefore, it is important to understand the underlying principles of each framework and adapt them appropriately to local ecological, epidemiological, and regulatory contexts. Providing feedback to these organizations when possible supports the refinement and updating of guidance documents, ensuring that recommendations remain relevant and effective. Guideline development was conducted in close collaboration with national policymakers to ensure alignment with both international and country-specific requirements. International and regional guidance from the World Health Organization and the Pan American Health Organization informed standards for integrated vector management, surveillance, outbreak response, and control of malaria, dengue, Zika, chikungunya, Chagas disease, and leishmaniasis. Additional technical guidance from the U.S. Centers for Disease Control and Prevention supported surveillance definitions and outbreak management relevant to the Americas, while the World Organization for Animal Health contributed considerations for zoonotic vectors and animal reservoirs. At the regional and national levels, ministries of health across Central America and regional coordination mechanisms, such as the Central American Integration System and the WHO, and other collaborating centers, ensured adaptation to local regulatory frameworks, vector control programs, and malaria transmission contexts. This multi-level approach supports harmonized, evidence-based vector control policies across Central America. From an implementation perspective, alignment should begin with Pan American Health Organization's regional guidance, which provides country-adapted strategies, standardized reporting tools, and operational checklists for vector control in the Americas. This should be complemented by the World Health Organization regional and country-specific guidance on integrated vector management, surveillance, and outbreak response. National Ministry of Health plans then ensure contextualization to local epidemiology, regulatory frameworks, and operational capacity. Cross-border coordination mechanisms, including Central American Integration System and Central American Health Secretariat, are essential for timely information sharing and outbreak response, while CDC resources offer added value for travel-related risk communication and clinical guidance. Finally, incorporating a One Health perspective through World Organization for Animal Health and WHO resources strengthens management of zoonotic vectors and animal reservoirs. Together, these steps provide a practical, harmonized pathway for evidence-based vector control implementation.